My name is Brooklyn Ballard, and I'm first going to verify the healthcare provider order. We have Mr. Ren Harami. He is male. Date of birth is 3/3/83. Patient ID number is 160-01-1180. He has been admitted after a motor vehicle accident with a suspected broken pelvis. He will need a double lumen catheter inserted right away before he goes to x-ray. The physician orders an anchor retention catheter to a dependent drainage system before he goes to x-ray. The order says to insert the retention catheter to a dependent drainage as ordered for a male client. First, what I'm going to do is I'm going to wash my hands. Next, I'm going to gather all of my supplies. So I have my healthcare provider order. I have my non-latex gloves that are sterile, unopened, intact, and unexpired. I have my sterile catheter kit tray that is unopened, intact, and unexpired and sterile. I have my clean gloves that are intact, and I have 3 clean washcloths, and I have my basin filled with warm water and soap. So we're going to gather all that up, and we're going to go into the patient's room. It's gonna knock. Hello, my name is Brooklyn. I'm going to be your student nurse today. I'm going to wash my hands. Okay, I'm going to pull for privacy. Can you tell me your name and date of birth? He says Ren Harami. Date of birth is 3/3/83. Okay, and how are you today, Mr. Harami? He says good. Okay, so what I'm going to do first is I'm going to verify the patient's ID band against the healthcare provider order. So on the patient's ID band, the patient's name says Ren Harami, and on the healthcare provider order, the patient's name says Ren Harami. On the patient's ID band, his date of birth says 3/3/83, and on the healthcare provider order, the patient's date of birth says 3/3/83. And on the patient's ID band, the patient's ID number is 160-01-1180. And on the healthcare provider order, the patient's ID number is 160-01-1180. So they all match up, so therefore it's okay to proceed. So next, I'm going to explain the procedure to the patient. So today we're going to be inserting a retention catheter to a dependent drainage. Is that okay with you? And he says yes. Okay. Can you tell me where you are? And he says the College of Nursing building. Can you tell me what day it is? He says Wednesday. Can you tell me what month is coming up next? And he says May. So the patient is alert and oriented ×3. And are you allergic to betadine or latex? And the patient says no, so therefore it's okay to continue on with the procedure. So next what I'm going to do is I'm going to raise the bed up to an appropriate height, and I will lower the side rail down that is closest to me. And now I'm going to go ahead and I'm going to get my supplies in line. Okay, so I'm just going to wash my hands first. And I'm going to gather 2 clean gloves. So I am first going to assess the patient by percussing and palpating the bladder. And we are going to be looking to see if there's any urinary retention. We could also use a bladder scanner to do this. And so I'm going to go ahead first and percuss the patient's bladder. Next, I'm going to go ahead and palpate the patient's bladder. Okay, and I did notice that there was some dullness upon percussion. And then after I palpated, I would ask the patient, was there any pain or tenderness with that? And he said no. And I did notice that we did have some distension in the bladder, so therefore. And we were assessing for urinary retention, so we were going to go ahead and continue on with the procedure. So I'm going to remove my gloves, discard them. I'm going to wash my hands. Okay, and next what I'm going to do is I'm going to get another clean pair of gloves, and we are going to assess the patient to see if he needs any pericare done before the procedure. So we are assessing the patient, and there does need to be pericare done before the procedure. So I have my my basin full of warm water and soap and my 3 clean towels. And if the patient was a male and they were uncircumcised, we would retract the foreskin back. We would then do our pericare. we would then do the procedure, the catheterization, and then we would do the pericare at the end, and then we would then be able to return the foreskin back to its original position after we did all three. So now what we're going to do is I'm going to get my rag wet of warm water and soap, and we're going to clean around the head of the penis in a circular motion. We're going to get a different part of my rag. We're going to go around the shaft of the penis in a circular motion, different part of my rag, and we're going to go up and around the scrotum in a circular motion with a different part of the rag. All right, and next I would fill my basin up with just warm water this time and rinse out the soap and water the first time. So we just have warm water in our basin now, so we're just going to rinse off the, first we're going to rinse off the head of the penis, so we're going to go in a circular motion around the head of the penis, different part of the rag. We're going to go around the shaft of the penis and with a different part of our rag in a circular motion. Then we're going to go up and around the scrotum in a circular motion with a different part of the rag. Next, we would pat dry the patient if they needed it. Okay, so now I'm going to remove my gloves. I'm going to wash my hands. Okay, next we're going to go ahead and open up our sterile catheter kit tray. I will designate this as my garbage and put this at the foot of my bed. Okay, and so we're going to go ahead and we're going to open up the tray first away, and then we're going to open to the side, and then to the side, and then we can now pull down toward us. Okay, so now that we have our sterile field open, I'm now going to make sure that I keep my sterile field in my line of vision at all times, and I'm just going to step right over here so I can put on my sterile gloves. And again, I'm keeping my sterile field in my line of vision when I do this. So when I go and put on my sterile gloves, I am going to make sure that I have a table that would be above my waist, and I'm going to keep my hands above my waist at all times when doing this. So first, I'm going to open up my sterile gloves. Okay. Go ahead and we're going to open up. Okay, so I'm first going to go ahead and pick up the cup. I'm going to hold it above my waist. Okay, again, I'm keeping it above my waist. Now I'm going to make sure that I leave my thumb out as I go and pick up my second cup, and I'm not going to use my thumb. So I'm leaving my thumb out. I'm above my waist. Okay, and we have two sterile gloves. I'm going to swipe that. Again, keeping my hands above my waist. So now what I'm going to do is I'm going to go ahead and get rid of anything that I don't need in my tray. So I don't need this. So I'm going to go out and away from the sterile fill. And I don't need these gloves. So I'm going to go out and away from the sterile fill. And I'm now going to go ahead and open up my drape. Again, I'm not going to cross over my sterile fill. And I'm going to make sure that I leave the shiny side down. And we're not going to cross over our sterile fill. Not going to let the drape touch me. And I'm not going to let the drape touch the patient. So we're going to go ahead and let go. Okay, so I have my drape ready to go. Now I'm just going to get my tray and set that down. Okay, so now I'm going to go ahead and first I'm just going to go ahead and pour my betadine onto my cotton balls. And then we're going to go out and away from the sterile fill. And now what I'm going to do is I'm going to, since I have two sterile hands, I'm now going to go ahead and lubricate my catheter tube. So I'm going to go ahead and I'm going to pick up my tube. Again, I'm not going to cross over my sterile fill. Okay, so I'm not going to hold it more than 2 inches back when I lubricate it. So I'm going to get my lubricant. We're going to open it up. Again, we're not reaching over the sterile fill. And we're not going back more than 2 inches. Okay, and now I'm just going to lay my tubing down right here so I don't cross over my sterile field. We're going to go out and away. Okay, and now I'm going to go ahead and attach my syringe onto my catheter since I have 2 sterile hands. So I'm going to reach and grab my syringe, and we're going to remove the cap. We're going to go out and away. And now I'm just going to go ahead and attach my syringe right there till I'm ready to use it. Okay, so now that I have my syringe ready, my catheter ready to go, we're going to first go ahead and clean off the urethral meatus of the penis with our betadine cotton balls. So I'm first going to go ahead and I will grasp the penis at a 90-degree angle with my non-dominant hand, so therefore my left hand is no longer sterile anymore. I'm going to grab my forceps, and we're going to go ahead and we are going to first clean around the urethral meatus with our betadine, with our cotton ball covered in betadine. We're going to go in a circular motion. We're going to go that way. Then now we're going to pull back and throw it. Okay, and next we're going to go ahead and go up around the urethral meatus at the top, a little at the head of the penis. Okay, and then we're going to go out and away. And then we will just rinse off any excess. We're going to go out and away. Okay, I don't need these anymore, so I'm going to go ahead and go out and throw them away. And I don't need my tray anymore, so we're going to go out and away. Okay, so now we're ready to go ahead and insert the catheter. So I will be inserting the catheter into the urethral meatus. And again, I'm keeping my hand at a 90-degree angle. And I'm going to instruct the patient to take a deep breath as I do this. And again, the foreskin is still retracted if we have an uncircumcised male patient. So I'm going to pick up my catheter, and I'm not going to make sure I don't go back more than 2 inches from the catheter. And so again, I'm going to go into the urethral meatus, and I'm going to instruct the client to take a deep breath. And we're going to make sure we do not touch our sterile hand against the penis when we do this. So we're now going to go ahead and go in. And again, we're not touching the penis with our sterile hand until we stabilize the catheter. And we're going to go all the way up to the Y fabrication. Okay, so now that we are all the way up to the Y fabrication, I am now going to stabilize with my non-dominant hand, and I'm now going to inflate the balloon. Okay, and now that our balloon is inflated, we're going to pull all in one motion to the foot of the bed. And our balloon caught now, so we can go ahead and we can unscrew our syringe, and we're going to go out and away. And I can now go ahead and remove the bag and lay that on the bed. I'm going to remove my sterile gloves. Okay, and then I'm now going to wash my hands now that I'm removed my sterile gloves. Okay, and I am now going to go ahead and put on a new pair of clean gloves. Okay, and now that we have inserted the catheter and it is secure now, we will now do peri-care, and I will do that just as I did before, except this time I will wipe all the way down the catheter, removing any irritants such as betadine or latex. And now that we have done the peri-care, I can now return the foreskin back to its original position. And now what I'm going to do is I'm going to go ahead and we're going to tape the catheter onto the patient's leg. And when we do this, I'm first going to put down one piece of tape to the patient's leg so that there is no skin breakdown. So there's my first piece of tape. Okay, and then next I'm going to go ahead, get that ready to tape. And when we tape, we're going to make sure that we are not, there's no strain in the catheter tube. So we're going to hook right here, and then we are going to tape. And we just want to make sure that it's not too tight, it's not pulling, and that there's no strain. And so now what I would do is, if we were actually had a real hospital bed, I would attach this bag to a non-movable part of the bed. And when doing so, I will make sure to keep it below the patient's bladder at all times so we don't have any backflow. Okay, and so now that we have that done, I'm now going to remove my gloves. I'm going to wash my hands. And I'm going to raise the side rail up that's closest to me, and then I'm going to lower the bed back down to its original position, and I'm going to make sure that the patient's comfortable, and then I'm going to document. So I'm going to document that the patient's urine was a pale yellow color and that it was clear. And then I would say the patient had about 150 milliliters of output. And the patient, I'm going to document that the patient did well tolerate throughout the procedure. I would say he tolerated well throughout the procedure. Okay, and that there was no foul smelling odor. Okay, and then I'm going to date it. And I'm going to put the time down. I'm going to initial. Okay, and I'm now going to show my documentation, and that's it.